Welcome to the latest HACSU vodcast, your Health and Community Services Union, with a member update with the State Secretary Robbie Moore. Hi, Robbie.
Hi, Esther. Great to be talking to you again.
So many things to get through, industrial action, more industrial action to come. But first of all, I wanted to talk about the new Health Minister, Jackie Petrusma, taking over from Guy Barnett, who is now Deputy Premier. Where are we at with that? Have you had a conversation with her?
Yeah, look, I have had a conversation with her. It was really good, actually. She called me on Sunday when the announcement was made that she's going to be a health minister. I mean, this does just show the chaos that this government continues to be in. But having said that, we're going to give Jackie, absolutely every chance to get the job done that needs to be done in health. The reality is that having Guy Barnett as a part-time health minister was never good enough. He was also Attorney General. There's no way you can be an effective health minister and do a portfolio as large as Attorney General as well. So I welcome that she's now pretty much a full-time health minister. Look forward to meeting with her next week to start to work through the significant issues in our health system that continue to happen, and are very hopeful that she'll be able to put a new focus on this and start to actually deliver some changes to our health system.
She's a registered nurse as well. Do you think that maybe she'll be able to have some understanding on a sympathetic level for what is happening in the healthcare system in this state?
Look, I think having a health professional, a nurse in this case, involved is actually a really good step and will mean that she can focus with quite a degree of knowledge of the health system already, although she has been out of it for some time. But the reality is that can only be an advantage for us, and we're really hopeful that she'll start to listen to us. But we've got so many significant issues that she needs to get across, and we're obviously really keen to start working with her on that.
The Delegates Conference, which is happening in November, and Guy Barnett had committed to that after the HACSU health debate, Tasmania's first. He was coming as a bit of a report card. Is she going to take his place?
Yeah, well, that was the first question I put to her when I spoke to her on Sunday, and I can now say that I've just got confirmation that Jackie Petrusma will be attending the HACSU Delegates Conference in November, which is a really good step because that means she can come face-to-face with hundreds of healthcare workers and answer their questions about what's happening in our health system and what she's going to do to fix it.
And some of these issues I'm sure you'll be covering off on: cleaners taking industrial action. Give us a recap as to why and where we're at with that.
Yeah, sure. So last week, cleaners at the Royal Hobart Hospital stopped work for 1 hour, and they did that because of a number of issues they had that management was ignoring them on. One of the biggest issues was that there was a threat to bring in private contract cleaners. As a result of their action, I can announce that the government have backed down on that and have guaranteed that contract cleaners won't be coming in. There are still a lot of other issues. We've seen nepotism within the department where people get promoted without a fair process. All of these sorts of issues aren't resolved yet, and we're continuing to campaign and to meet with management in relation to that. And we're hopeful that we can get there, but there are a lot of issues still to work through in the environmental services area. And
we also had industrial action with IVF staff taking that this week. What's happened since that action?
Yeah, so it was pretty amazing to see TasIVF, which is the first time we've seen these sort of private sector, small organisations where workers have been able to stand up to a big national company. So we saw significant action, and they have to do that under the Fair Work Act, which is quite complex. They took that on, they turned out in numbers, and they've got significant issue. The main issue is that they are paid less, on average about 10% less than the people doing exactly the same job for the same organisation based in Victoria. So members have had enough. They've got staff shortages because they can't attract staff. And so we saw members come out, talk to the media and take a stand. So we haven't heard anything from TasIVF yet, but if they don't come back to the table and negotiate in good faith, members will take further action. So it was tremendous to see them take that action. This is a highly profitable employer, and they can afford to pay staff fair wages. They can afford to pay the staff in Melbourne that. There's no excuse for paying Tasmania's workers less. They charge the same here. It's exactly the same duties. In fact, some of the duties they've picked up for Melbourne around admin and things like that lately just to help them out, and yet they're paid less. It's totally ridiculous and it needs to be resolved.
There's also Northwest regional nurses that are taking action too.
Yeah, Northwest Private Hospital nurses are taking stop work action next week on Tuesday. They're doing that because their employer is failing to negotiate in good faith. they've put a pathetic wages offer to them. And again, we see the same case as we often see, where they're paid so much less than their mainland counterparts, and in this case, often their public sector colleagues. So we need to see a decent offer put on the table for them to come back to the table, negotiate in good faith, and to make a decent offer that improves wages and conditions.
It feels like the health system's imploding. Robbie, have you ever seen so many actions taken in so many different sectors?
I've never seen a situation like this where workers are just being mistreated and not listened to by management across the board, and workers have had enough and they're taking a stand, and it's fantastic to see, and we're seeing some good wins, but we've still got so many more challenges ahead of us, and to see people like at the Northwest Private Hospital, like TasIVF, taking it up to large national corporations who often use hostile right-wing attacks on them to try and prevent them from taking action by threatening to dock their pay and all of this. It's just been fantastic to see these workers stand up and fight back.
And it's also been fantastic to see, and we did a vodcast on it the other week, Allied Health standing together. There's a new agreement that's coming, and we have a survey. It's not too late. If you put it in people's faces, you want to get a feedback on what Allied Health need because of this new agreement that is coming. Can you tell us about that?
Yeah, so we're currently surveying members covered under the Allied Health Professional Agreement. We're also surveying members under the PSUWA, which is the general agreement as well. Those surveys are to find out what are the most important issues for members out there, give us an idea of what wage increases are needed, what conditions we need to see improved to help retract it and retain staff. And we're really keen to hear from every single member. The surveys close on the 1st of November, so a big plug to please do that. We did have a technical issue over the weekend. That's been fixed. So please complete the surveys now, get them back to us, and we'll use that to draft a log of claims for you to consider over the next month.
The PSUWA, of course, the Public Sector Union Wage Agreement. Medical imaging, that's what I want to talk to you about. Medical imaging, you've had a huge win.
Yes, this is fantastic news. These members have been taking industrial action for over 2 months. They've stopped work on 2 occasions. They've had industrial bans in, and those bans have finally worked, and they've now got an announcement of a market allowance, 10,000 for all staff, and for sonographers who had a special case, they've actually increased their wages by 20%. So this is a successful campaign. It's not everything that everyone wanted, but it's pretty close. It's obviously a really important outcome for these members who fought so hard.
Robbie Moore, State Secretary for our Health and Community Services Union, thanks so much for the update.
Thanks, Esther.